Welcome back to Houston Life. March is National Cerebral Palsy Awareness Month, and here in Houston, we have some of the latest treatment options for patients with CP. Joining us now is Dr. Manish Shah, a pediatric neurosurgeon with UT Health and Children's Memorial Hermann Hospital. Dr. Shah, welcome to the show. This, for many families, is a scary diagnosis. Break it down for us, because I think for a lot of our viewers, we've heard of cerebral palsy, we've heard of CP. What exactly is it, and how does it affect those who are diagnosed with it?
Derek, thank you so much for having me. That's a wonderful question. Cerebral palsy, the two words mean brain stroke. So as you can imagine, it is an umbrella diagnosis. And it encompasses many, many, many different presentations of the disease. So sometimes when a common person hears the word cerebral palsy or CP, they just assume that it is a child who's going to be in a wheelchair for the rest of their lives. And that is very untrue. So there's a large spectrum. There are children who are very minimally affected. And so the words just indicate that you have some kind of motor disorder and you can't move as well as everybody else.
There are a number of factors that can cause cerebral palsy. Is it something that can be avoided?
It isn't something that can be avoided. It is something that is usually involving an injury that happens to your brain either in the womb or right around the time of birth. And usually is affected with prematurity.
Okay, so premature birth, low birth weight, brain trauma, sometimes substance abuse by the mother. What are some of the signs of CP? Because this is something that for new parents out there, you have this perfect bundle of joy home from the hospital and you're worried about everything, right?
Absolutely.
What are things that we should be looking for?
Great question. So when the child progresses through the stages, every couple of months, they're supposed to meet milestones. So before the age of 3-4 months, they're really supposed to be able to lift up their head. But by 6 months, if they're not lifting up their head and they're still floppy, they're still a little limp, one should be concerned. If after that, by a year, they're not rolling over, they're not sitting up, they're not trying to crawl, and if by 16 or 18 months, they're not taking steps, these are the things that should alert us to maybe we should look at the child, and early intervention, which is primarily with physical therapy, is critical to the success of children with cerebral palsy.
Interesting. So the earlier you notice these signs, if there is an issue, getting treatment can actually help the child.
It can dramatically alter the course of the disease, yes.
Okay, I feel like that's a very, very good point. Let's talk about treatment, because for families who are in this situation, again, this is a helpless, scary feeling for a lot of people. But the good news is we live in Houston, one of the best cities in the world for medical care. So talk us through some of the treatment options for CP.
Yeah, this is the best city in the world. So
there you go.
Yeah, the critical thing to treating cerebral palsy is to be looked at by a team of people who do this all the time. So the last thing you want, if you're a parent, is to go to one doctor or one therapist and then go to another doctor and have 2 to 3 months in between, and everybody recommends something different. It's much better especially being in Houston with the advanced centers that we have, to be evaluated by a therapist, a neurosurgeon, or an orthopedic surgeon, a physiatrist, to get the combination of things that you need. Every patient with cerebral palsy is different, as we talked about, and everyone needs something a little bit different. And so we can combine therapies and Botox injections and surgeries, like minimally invasive neurosurgeries that we do in the back, to treat a child who would otherwise potentially be doomed to a life in a wheelchair with minimal mobility, and make them independent walkers. And that's what we do. We work together to do that. And the team approach is the most important thing that can happen.
And the pediatric neuroscience team, what you just said, the team approach, that's the most important word, right? Because
Absolutely.
Instead of going to doctor after doctor, explaining your story from the beginning, everyone is working together to help this child live a long, healthy life.
Absolutely. At our Comprehensive Spasticity Team Center clinic, all 5 or 6 of us will see the patient at the same time, make a treatment decision, and then enact it. So we actually will sit there, make a checklist, give it to the parents, and go through it over time, follow it with them, make sure all these things happen. That's what we need to do for every child, and that's what we do.
Dr. Manish Shah on this Cerebral Palsy Awareness Month, thank you so much for stopping by. And you want this guy on your team for sure. Thank you so much for
You're
all
so
that.
kind, Derek.
Appreciate it. And in the meantime, for more information about pediatric neuroscience services at UT Health Houston and Children's Memorial Hermann, you can visit their website, memorialhermann.org/children's-neuro, or you can give them a call, 713-222-2273.